I was trying to see full screen. That's not working properly.
Okay, okay, no problem.
So my humble pranams to Vaidyavani BS Warriors, who is our founder, Lord Vishwam, PM Madhava Warrior, and our Guruji, Padma Bhushan, Dr. P.K. Warrior sir, who taught us what is Ayurveda, what is the treatment in Ayurveda, traditional Ayurvedic way. So many things. I had an opportunity to work with P.K. Warrior sir for nearly 5 to 8 years. And whenever we meet, he used to discuss so many clinical conditions and suggestions, and was very, very, very enthusiastic about the modern Ayurvedic research, so many things. So my humble pranams to Guruji. Today I'll be talking to you about some of the indications of Asavas and Aristas. I think all of you are quite aware that Asava and Arista is very common in Ayurvedic industry. आजकल तो बहुत ज्यादा है आसवा और अरिष्टा. हमारे पास काढ़ा है, कषायम है, लेह्यम है, घी है और तेल है मसाज के लिए, वेरियस टाइप्स ऑफ तेल है, गुड़िका है, वटिका है, औषधियां है, भस्म औषधियां है, बहुत सारे हैं. इसमें सबसे चीप भी है. पब्लिक, जनरल पब्लिक को ज्यादातर परहेज नहीं करा बिना करके यूज करना बहुत ईजी है आसवा एंड अरिष्टा. इसलिए हमारा पौराणिक ऋषियों ने बहुत सिंपल योगों को पब्लिक को यूज करने के लिए आसवा एंड अरिष्टा फॉर्म में बनाया है. ये हमारा आसवा एंड अरिष्टा का स्टैंडर्डाइजेशन का हमारा कोटेकल में जो फॉलो कर रहे हैं, इसका इस जगह ये ड्रग गवर्नमेंट ऑफ इंडिया के तरफ ये स्टैंडर्ड फॉलो करना हम करते हैं. उसमें टोटल सॉलिड कंटेंट, स्पेसिफिक ग्रेविटी, टोटल रिड्यूसिंग शुगर, नॉन रिड्यूसिंग शुगर, पीएच वैल्यू, अल्कोहल कंटेंट वगैरह हम देखते हैं. हमारा आसवा और अरिष्टा में 3 to 13 to 15% as alcohol naturally generated alcohol है, naturally generated. because आजकल पब्लिक को बहुत डाउट है ये नेचुरली जनरेटेड अल्कोहल है क्या, डिस्टिल्ड है, और दारू से क्या फर्क है, इसमें कुछ लिवर प्रॉब्लम फ्यूचर में आ जाएगा. ये नहीं आएगा क्योंकि ये नेचुरली जनरेटेड अल्कोहल को हार्म बहुत कम है और हम दूसरा केमिकल्स वगैरह नहीं डालते, खाली ये ड्रग्स है. So I will directly go to my first slide, important slide. Abhayaristam, all of you are very well aware of Abhayaristam. I think you are also using very commonly in your daily practice also, Abhayaristam. In Chikitsa, there are 5 types of Asavaristas are mentioned. They are Abhayarista, Dandyarista, Duralabharistam, Pudikaranjasava, and Pudivalkasava. All the 5 products we are using in the general practice. इसमें क्या क्या फर्क है? अभयारिष्ट और दुरालभारिष्ट में क्या फर्क है? आप देख सकते हैं कि आजकल पाइल्स का बीमारी बहुत ज्यादा है. सो अभयारिष्ट ग्रुप ऑफ मेडिसिन अरिष्टा-आसवाम का भी यूज बहुत ज्यादा है. इसका इंग्रेडिएंट देखे तो आम्ल की हरितकी है बट बीबीतकी नहीं है त्रिफला में, मरिचा तिप्पली है, शुंठी नहीं है, और इसके साथ विशाला भी है, और कपित्था, लोथरा, बिलंगा, एला कषायम है, और बहुत सा काली कषायम है. धातकी का चूर्ण बना के मिलाते हैं, बनाते हैं. इसका फलश्रुति में अर्शस, ग्रहणी वगैरह बहुत डिटेल बताया है. This is one of the best virejan option. That is the main thing you have to keep. Kottakkal Ayurvedashala, Abhayarista is very best Virajana Aushadha, but not Tekshna Virajana. That is the very important thing. Normal course Virajana is a very best action, and it improves the digestive power also. So over the counter, public used to purchase this product and use it. 25 ml to 30 ml is the normal adult dose. So it is very, very effective. So other indications, Jwara, Shobha, Pliha, Hridroga, Gulma, etc. You know very well. You are using it also. Very important thing that ये तो कृमि में उदर जन्य कृमि में बहुत अच्छे रिजल्ट देते हैं, बहुत अच्छे रिजल्ट. बच्चों को भी यूज कर सकते हैं. 5 to 10 ml is the pediatric dose. उसमें पानी मिला के देना. बच्चों को जब आप वासवारिष्ट देते हैं तब उसका इक्वल क्वांटिटी पानी मिला के दे, सीधा मत देना. इट इज वेरी इंपॉर्टेंट. और इसका डिफरेंट यूज देखते हैं. I don't know how many of you are aware of Kottakkal Ayurvedashala's karmic code. That is the only Arka preparations Kottakkal Ayurvedashala is manufacturing. It contains Ajmoda, Tippali, Shundi, Shweda Jiraga, Elaichi, Hinku, Shreya, Tok, Pudina, and Sita. It is generally well effective, good effective in the various types of gas problems. But if you mix this karmic code with Abhayaristam, the action will be double. I'm very sure, double action. Either you can mix 300 ml of Abhayaristam with the karmic code and make it a 500 ml. Karmic code, one bottle is 200 ml. Make it 500 ml. And 25 ml twice after food. Such a fantastic result. बहुत अच्छे हैं, बहुत अच्छा रिजल्ट देते हैं. इसके साथ साथ आपको महाधानोदर गुड़िगा, धानोदर गुड़िगा और आषाढ़ आदि गुड़िगा वगैरह और हिंगू आदि गुड़िगा वगैरह मिला सकते हैं. वो उसको एक्शन को गुणित करते हैं. सो कार्मिकोट और अभयारिष्टा यदि अलग अलग मिलना है तो 15 ml of Abhayaristam, 10 ml of karmic code. That is the combination form. And next is the Abhayaristam with the Kutajaristam. Various types of mouth ulcer. I think all of you are doing very, very good practice and having all these type of combinations. फिर भी मैं बताता हूँ मेरे एक्सपीरियंस है, अभयारिष्टम और खदिरारिष्टम साथ इक्वल क्वांटिटी मिला के पी लो. माउथ अल्सर के लिए, वेरियस टाइप्स ऑफ माउथ अल्सर के लिए बहुत अच्छे रिजल्ट देते हैं. और अशोकारिष्टम प्लस अभयारिष्टम, आजकल लड़कियों को मेंसेस रिलेटेड पेन बहुत ज्यादा है. मे बी पीसीओडी, मे बी सम अदर प्रॉब्लम, मे बी ड्यू टू द कॉन्स्टिपेशन और मे बी ड्यू टू सम अदर गैस्ट्रोइंटेस्टाइनल पीआईडी प्रॉब्लम्स. आजकल बहुत ज्यादा है, especially young girls in the beginning. Menses related pain, if you give Asavas with Abhayaristam, it is very, very effective. I'm telling you, you can note it down. You can practice today itself. Start practicing. Equal quantity, 15 ml, 15 ml, twice after food. The important thing you have to keep it in mind that usually the menses pain experience either the one day before the menses or the first day of the menses. So you can start the administration of Asavas and Abhayaristam 10 to 15 days before the date of menses. There is no compulsory that the entire month you have to use. 10 to 15 days before the menses, if you start using the Asavas and Abhayaristam, at least continuously, और 6 महीना 8 महीने तक कंटिन्यूस यूज करो, आपका ग्रेजुअली पेन कम होने का पेन पेशेंट विल रिपोर्ट. पहला महीना द्वितीय महीने में आपको खाली इतना खास फर्क नहीं मिलेगा. You can feel the patient will come say that 3rd month, 4th month onwards, धीरे 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 पेंसेस रिलेटेड दर्द कम हो जाता है. It is very effective. And Pippalyasavam plus Abhayaristam, that is a very common combination in Kerala for various type of general gastrointestinal gas related problem. And similarly, Abhayaristam and Jiragaristam. Jiraga contains Jira Kada. अच्छा क्वालिटी जीरा काढ़ा का जीरा अरिष्ट फेमस है, आपको मालूम है. जीरा अरिष्टम एंड अभयारिष्टम मिलाए तो इट इज गिविंग वेरी वेरी गुड रिजल्ट, स्पेशली आयुर्वेदिक तरह से गुणमा उदावरता इत्यादि कंडीशन में बहुत अच्छे रिजल्ट देते हैं. एंड दोस हु आर हैविंग रेगुलर कॉन्स्टिपेशन, Abhayaristam 30 milli, Sugabedi tablet 1 or 2 twice daily is very effective in the normal case of constipation. Normal case, especially aged walon ko, umru walon, senior persons. So if they use it regularly, they will get a normal clear motion. And those who are having diabetes and related constipation, better is give Laxacot also. Kotekal ka Laxacot, 10 gram at bedtime, Abhayaristam and Sugabedi. So those very chronic constipation, that is very, very effective. And Abhayaristam plus Parthadyaristam. Already in the Palashudi, it is told Hridroga. You give Abhayaristam plus Parthadyaristam. It is very effective. Again, हमारा तो HT कोट है ना BP control के लिए. HT कोट इसके साथ साथ दे सकते हैं. So BP control is very effective in Abhayaristam plus Parthadyaristam. And in the Shobha condition, Abhayaristam plus Punarnavasavam is good. Those who are having the chronic alcohol-related liver diseases, the Balashudi, it is told Udara, chronic liver disease especially due to the alcohol. Regular use of Abhayarishta will give to certain extent a good result. I won't say that it is the only treatment. You can give other medication also as a supporting measure. You can use Abhayaristam as a regular measure, which will improve the digestive power and improve the liver function. And in that, next comes the Dandhyaristam. Dandhyaristam is the second Aristam told in the Chikitsa, which is superior to Abhayaristam in Virechana. It contains Nagadandhi, Dashamula, and Triphala. That's all. And it is superior. And it contains the Chitraga also. Sorry. Nagadandhi, Dashamula, Triphala, and Chitraga also. Dhataki is Churna. There is no other Churna included. It is more powerful Vijrayana than Abhayarishta. And it is one of the best Shobhara also because of the Dashamula in it. There is no need of mixing with anything else. But chronic constipation, if your Abhayaristam and the Sugabedi is not working, you can use Dandhyaristam and Sugabedi twice daily. That is also very effective. And this Virechana Gudika and Krimishodhini, Valiya Andragudaram, etc. strong purgative. Regular use ke liye Dandhyaristam Sugabedi is best. And next is the Duralabharistam. So many people have the confusion regarding the use of Duralabharistam. Duralabharistam is very, very effective, but it is not a drastic purgative. It contains Duralabha, Nagadendhi, Triphala, Chitraga, Padha, Abhaya, Amalagi, Vasha, Shunti, etc. as a kada. And the so many drugs and the Churna also. Though it is Malabandhara, it is effective in Pravahika group of gastrointestinal problems. Pravahika group. Not only the Arshas. Okay, in Arshas, if you get use, you will get a normal motion because of the Nagadendhi, Triphala, etc. But if you can use it very commonly in Pravahika, in Bombay and all, you will get this type of constipation. Either too much motion or bar jane ke liye tendency and gas also. In that context, Duralabharistam is very, very effective. It will give a normal bowel movement and it will control the frequent urge feeling also. It's very effective because of the Chitraka Pada, etc. And very important thing is, it is very common drug effective in the IBS group of diseases, inflammatory bowel diseases. It's very effective. And you can give it along with Chariyandra Gudaram or Hinguvadi Gudiga or Ashadhyadi Gudiga or Dashamula ala Dhanvandran Gudiga and all. For common public, it is very cheap and very effective also. And Duralabharistam is very effective in amoebiasis. Amoebiasis, you can mix it with the Krimikhna Vatika and Duralabharistam twice daily. And other medications also you can very well include. There is no problem. But be very careful while using in the ulcerative colitis because it is having Chitraka. Chitraka sometimes creates the bleeding. So ulcerative colitis, be very careful. And recta ulcers also, bleeding type of ulcers also, be very careful. You can add some medication with that one and you can use it. And anxiety related gastrointestinal problem. It is very common nowadays, especially working class and school going, college going youngsters. This anxiety related. Before the examination, before the interview, they get anxiety and bar toilet jane ka, motion jane ka tendency. In such people also, Duralabharistam is found to be very effective. I am using it. You can mix Duralabharistam with a Mustaristam to reduce it, to potentiate it. You can mix it Jiragaristam with the Duralabharistam also. That also gives almost same effect. Now I will go to Kutajaristam. I think the screen is having some problem, so title is not well seen. Kutajaristam. Kutajaristam is not a strong purging Aristam. And next comes the Pippalyasavam also. What is the peculiarity of the Kutajaristam? It contains Putikaranja, Chitraka, Kantagari, Mula, S, Kashaya, and so many powders in the Praksheba Dravya. The very important thing is that it contains Gukulu and Makshiga Dhatu. How many of the Asavaristas containing the Gukulu and Makshiga Dhatu? Anybody is aware of that one? Of course, Kottakal's Nimbamrdadi Panchadiktagam Yoga, Nimbamrdasavam is there. That contains the Gugulu in it. But Makshiga Dhatu is there in the Pudikaranjasava and next in the Kumaryasava. I have not seen any other Kottakal products containing the Makshiga Dhatu. So whatever the action of Makshiga Dhatu, you can expect from this Pudikaranjasava also. So it is very good medicine for Panduroga, Gara, Udara, Gunma, Pliharoga, Ashmari. It is good in Arshas and it improves the Agni also. As I told you, this is not a strong purging medicine. It creates only anulomana. Khali anuloman karte hai. And it is very good in diabetes related gastrointestinal problems. Diabetes related. And you can mix Pudikaranjasava with so many diabetic medicines like Kankainabadi, Pilosic tablet you can mix. And I have found it very effective, Pudikaranjasava with Kaishora Gulgulu in Arsho Bhagandara and Bhagandara. Arsho Bhagandara and Bhagandara. Those who cannot follow the strict diet in Bhagandara case, start using the Pudikaranjasava with the Kaishora Gulgulu daily. To certain extent, it is very effective. Only thing you have to give some purging medicine, Birech and Aushad only. So it will give to certain extent, Arsho Bhagandara also, it is found to be very, very effective. Not only that, various types of gastrointestinal polyp, this Pudikaranjasava is found to be very effective. Or and if you mix it Varanadi Vadam tablet with the Putikarajasava, this the GI polyp, gastrointestinal polyp, it is more effective. So Vidradihara, Varanagitikana is Vidradihara. So mix it with the Putikarajasava and because of Gugulu, Makshika and so many other things, it reduces the size of polyps. So some cases we may not be able to give Nimbavardasava because of the presence of Arushkar, Phalataga in it. May create allergy. So such cases, you can easily give Pura Pudikaranjasava with the Kaishora Gulkulu or Kanchana Ragul. And another thing, in liver disorder also, it is found to be very, very effective. Putivalkasava is the last thing that Arishok group Asavas Aristam. In Putivalkasava, that is a very weak medicine, but it's very effective in generally Aristas. It contains only Putivalka Kashaya and Trigadu Churnava, nothing else. And in Kushta, it is very effective. In some of the cases where there is Aristas and skin disorders are there. Mild skin disorder. I don't say strong one. Mild skin disorder. So in such cases, you can give Putivalkasava. And it is good in diabetes also. This diabetes also we found we are seeing some sort of skin lesions because of the skin dryness, itching, continuous itching. You can mix Ashada Basma or other diabetic tablet with the Putivalkasava. So it is found to be very, very effective. And in children, with the Kremikravatika, it is very effective for controlling the Udara Krimi, especially children. So that's all about the 5 types of Asavaristas mentioned in the Arshas. You can have any more doubts, you can ask. So I am coming to the Balarishtam. Balarishtam is a very common thing which you people are using. It is just like the Dashamula-aristam. It is good for the total body strength and improves the Agni and generally used in various types of Vata rogas, and it increases the Bala and Pushti of the body. That is its indications. And it is very effective while using it with the Yograja Gulku or Kotakal's Ruko tablet. Or you can add Rasteranda tablet or Ostikot tablet with the Balarishtam. According to the age, 1 or 2 tablets. And Surya Prabha, that is 1 tablet, but 2 tablets you can add along with the Balarishtam to improve its actions. Chandra Prabha, if there is some swelling or some other inflammatory conditions are there. If you add Balarishtam with the Punarnavasavam, it becomes a Shobhahara, anti-inflammatory and reduces the swelling. And if you add Nimbamritasava, it is more powerful. I am coming to that one while discussing the Nimbamritasava. And if you add Chitragasava with the Balarishta, it reduces the Shobha. Chitragasavam and Balarishta. So Balamridam, next. Balamridam is the exclusive Kotakal Arivaidhyashala product. Balamridam and Vishwamridam. No other companies manufacturing these 2 products. Balarishta is indicated for the adults, but Balamridam is indicated for the children. It is the pediatric medicine, exclusive pediatric medicine, Balamridam. It contains Draksha Kashayam and churnas like Chavika, Maricha, Tippali, Krishnamula, Shunti, Sariba, Yashtimatu, Talisapatra, and Brahmana Aushadis like Akshoda, Bada, Rambhabala Churnam, Parushaka Bhala Churnam, etc. It is a Brahmana medicine for the children, not for the adult. It is indication told that Bala Shosha Haram, Balanam Sarva Amaya Haram, Sarva Amaya Haram. Especially children in the breastfeeding age, if the breast milk is not sufficient, if they are not eating other food, you can start using the Balamridam. According to the age, 1 ml, 2 ml with equal quantity of water. According to the my age, you can increase the dose also, no problem. So in the weaning prior time also, if baby is not willing to switch over to other type of food and weak, emaciated, you can start giving Balamridam. It is very, very affecting the Balaroga, various types of. And Bala Shosha, children's tuberculosis, pediatric condition, tuberculosis, constant cough and everything, and becoming the weak body. You can start using the Balamridam. It improves the body's vitality, Agni, Dhatu Poshana also it does. Especially in the present day context, post-COVID related health issues in the children, I found to be very effective. We cannot think about strong other Kashaya, Arishta and everything. And those who are already infected with COVID and very weak and emaciated, not able to consume any food, please start using the Balamridam. They will improve their Agni and improve their body strength and Dhatu Pushti also. So do not forget, this is a very best medicine, tonic type thing. Children, maybe you may be switching over to the Horlicks Boost or all these combinations, or some people directly jump into the Chavanaprash, Brahmarasayana and all these things. Do not start Chavanaprash, Brahmarasayana in the beginning. Start using Balamridam, then improve the Agni, then only switch over to the Chavanaprash. That is very important. And next pediatric medicine, which I am very familiar, I am very fond of, is the Vishwamridam. Vishwamridam is also exclusive cortical product. It is containing the Shunthi, Kashayam, and Chavika, Maricha, Tippali, Krishnamula, Shunthi, Sariba, and Deepana Pachana Churna. It containing Shunthi, Kashayam, and Deepana Pachana. While Balamridam is a Brahmana yoga, Vishwamridam is not a Brahmana yoga. Please keep it in mind. It increases the digestive power, Agni Vruddhi, various types of Jwara, not only for the children, adults also you can use. Atisara, various types of gastrointestinal problem, Gulma, Uda, and Aristas. Udara Shula, especially in children, youngsters, those who are regularly eating the street food, fast food, junk food, they will not get digested properly. So while they come back from the schools and college, they will say that, माँ ने मेरे को नहीं खाने का, मेरा पेट बहुत खराब है, और क्या खाया, KFC में जा करके वो खाया, ये खाया, पेट फुल है, डाइजेशन नहीं है, क्या करो, abdominal दर्द है, पेट में दर्द है, क्या करो? You can very well start using the Vishwamridam according to the age. So that improves the digestion, metabolism, and you can start using the other food also. Pandu and Shobha. Another important use of this Vishwamridam is, it is very effective in the postnatal condition, Prasutika, it is told. Immediately after the hospitalization and delivery, if the ladies are not getting proper appetite and digestion, maybe due to hospital food or some other complications or surgery, please start using the Vishwamridam for 4 to 5 days and improves their Agni. It is Prasudika, it is very, very effective. And post GI tract surgical case also, various types of surgery for the GI tract. And in such condition also, it improves the digestion. Vishwamridam is very effective. Irrespective of the condition, you can very well give. Vishwamridam ke saath Balamridam milao, wo Brahman bhi hai, Agni improvement bhi hai. It is very useful in children. In my practice, whenever there is severe respiratory tract, upper or lower respiratory tract infection, in the beginning, जो दवाई देना है, दशमूलकटत्रयम, व्याघ्रियादि, अगस्त्य, दशमूल, ये सब देकर के बाद इम्यूनिटी बढ़ाने के लिए क्या दो आजकल, वो पेरेंट्स का बहुत बड़े क्वेश्चन है. ठीक है, ये इम्यूनिटी बढ़ाने के लिए, कोविड से प्रोटेक्शन करने के लिए क्या दे सकते हैं? Maybe you people are very well giving the ashwagandha and all these things. But my practice to improve the immunity, I used to give the Balamridam plus Vishwamridam twice daily and Chavanaprasha or Brahma Rasayana at bedtime. Continuously use. I've seen so many cases, the protection from the common cold and cough and fever. Continuously give for 6 months, 8 months, 1 year. It's very good protection. One side we are giving the digestion improvement and Dhatu Pushtigara your combination and Chavanaprasha as a rasayan. It is very effective. And you can mix the Vishwamridam with the Mustarishtam also to improve the digestion and metabolism. And you can mix the Dasamularishta with Vishwamrita, Jiragarishta with Vishwamrita. All these combinations according to your knowledge. Only things, please, my friends, doctors, please hear me. Whenever we use a combination yoga formula, at least kindly remember the Phalashruti of that yoga. Phalashruti is very important. You may not be able to remember all these kada kya hai, churn kya hai, usme kya mila hai. At least uska Phalashruti yaad rakho. Phalashruti yaad rakhne ke baad aapko various combination bana sakte hain. एक ही दवाई से नहीं होता आजकल का प्रैक्टिस. We have to go for various combinations because आजकल बीमारी तो वैसे strong आ रहे. कोविड का शुरू में जो था वो थर्ड का स्टेज में वो नहीं था. आजकल केरला में बहुत सारे कोविड है, उसको लिए हम स्ट्रॉन्ग दवाई देना पड़ता है. People are coming to you after getting treatment in modern medication, 1 week more, 2 weeks strong antibiotics, steroids. इसके बाद आप लोगों के पास आ जाए. So we have to give the very strong medicine. Then only you can get the very good result. So Mustarishtam. Mustarishta contains the Musta Kashaya and various Deepana Pachana Aushadhas. This is not a Brahmana combination. Please remember. It is only improves the digestion metabolism. You can use it in any kind of gastrointestinal diseases, irrespective of the condition. And you add Dhanondara, Dhamadhanondara, Hingwadi Gudiga, Churiya Andaguda, Gudiga, all these things according to condition you can use. It will not give a normal motion, strong motion. A normal motion you can expect. Just like Abhayaristam or Dandhyarishtam. No, it is not like normal bowel movement. And those who are having chronic constipation, please do not use Mustarishtam. It only regularizes the bowel movement. And with the Indukanda, it is very effective. Indukanda Kwadam tablet. And paddhati gudiga, amoebiasis type of chronic pravahika type of condition, along with the paddhati gudiga, it is very effective. In Kerala, Mustarishta means the medicine for the children. Public is having that notion. Public, oh, Mustarishtam de do bachon ke liye. Mustarishtam ka is better दूसरा medicine बहुत सारे. I told you Balamridam Vishwam. But public is having a notion Mustarishtam is a good medicine for the children. Of course, it is good for children as good for the adult. And if you while you are giving Mustarishtam in children, you can add Gopi Chandanadi Gudiga in that one. All the pediatric condition is exclusive Sahasra Yoga preparation. Gopi Chandanadi Gudiga. All pediatric condition you can use. And in the Grahani type of condition, you can add Madhuasavam with that one. Madhuasavam and Mustarishtam mix you can add. And you can add Vishwamridam, already I told you. You can add Pippalyasavam also with the Mustarishtam. I am coming to the Mulakadhyaristam. I don't know how many of you are well versed in the use of Mulakadhyaristam. It is a special Sahasra Yoga preparation. I'm very sorry about this slide. Slide is all disturbed. Whatever I have typed, that is not coming properly. I'm very sorry about this slide. Please excuse me. So, Aristam is a yoga Arista indicated in the Bala Visarpa, to be used along with, always to be used along with the Mrdu Virechana, Shothana. Arista contains Mulaka, Haritaki, Karavi, Nimbatvak, Ela, Kutajabija, Jyotishmati, Dhanyaka, Vidanga, etc. The same yoga is there in the Mulakadi Kashayam also. I don't know how many you are using the Mulakadi Kashayam. So it is so told that it is useful in the Palavisarpa, various types of skin lesions of the children. You cannot use it as a single drug. Always you use it along with the Kutajaristam, Punarnavasavam, etc. Because if the dose is not properly adjusted, slight pitta gopa may happen. Slight pitta gopa. So it may aggravate the condition. So be very careful in the beginning. So I used to give along with the Vaidyavani, Madhuasavam, Punarnavasavam, or Vaidyavani, Kutajaristam with the Punarnavasavam. According to the age, 5 to 10 ml plus water and Gopi Chandana. So that is very, very effective. And various types of chronic skin diseases, this combination, especially Madhuasavam, Chitrakaasavam, Punarnavasavam, and Vaidyavani, or Madhuasavam, Vaidyavani, or Madhuasavam, Chitrakaasavam, especially various types of chronic skin diseases, it is very effective, especially lichen planus. Lichen planus is a very common problem in the cities, and there is no treatment in the modern medicine. They'll give the steroid medication for external application. There is no cure. But this combination is very effective. You can note it down. Vaidyavani, Madhuasavam, and Chitrakaasavam combination. And dry eczema, itchy dry eczema. I'm not talking about the oozing, weeping eczema. Dry eczema, this combination again, it is very effective. So only thing you have to add, you can add the Vilwadi Gudiga with that one, or Dushi Vishari Gudiga. I think how many of you are using Dushi Vishari Gudiga, Kotakals? Dushi Vishari Gudiga is a fantastic medicine in various types of skin diseases, especially for relieving the itching, Kanduhara. It is not only in skin disease, then garam also. Toxin, internal toxicity also, it is very effective, just like Vilwadi Gudiga. But it is very effective, Dushi Vishari Gudiga. If you have not started using the Dushi Vishari, please start using. Very effective. And you can. Madhuasavam is next, is the Madhuasavam. I think you are familiar with the Draksharistam, no? You see, Draksharistam is having the Draksha Kashaya in it. Madhuasavam is also having Draksha Kashaya in it. And Balamardam is also having Draksha Kashaya as the base. Madhuasavam and Draksharistam, what is the difference? Madhuasavam contains 17 types of Praksheba Dravyas, while Draksharistam contains the 8 types of Praksheba Dravyas only. So the effect of Madhuasavam is superior to Draksharistam. It is Vidipana, Arshas, Udravarta, Gunma, Udarakrim. And I want to underline that it is very effective in various types of ENT group of disease. Akshiroga, Galaroga, and Shiroroga. Specifically, it is told in the Phalashruti. Akshiroga, Shiroroga, and Galaroga. Madhuasavam is very effective. You can add Lohasava with the Madhuasavam or some other Aristam according to the condition. Or Madhuasavam with the Punarnavasavam also very effective. And always try to use Triphala tablet in eye diseases or Saptamrta Loham with the Madhuasavam. In the anemia, Panduroga condition, anemic, chronic anemic condition, Add always Annabedi capsules or Loha Basma, Kandavasma according to the conditions. It is very, very effective. Whatever I am telling from my experience. Found to be very effective. And I always write Brudvigarishtam, not the Draksharishtam. It is very effective, very useful combination. Now I am coming to the Asavas Aristas used in diabetes, Prameha Roga. There are three Aristas and Asavas specifically useful in the Prameha Roga according to our this thing. Ayurveda is preparing 46 types of Asavas and Aristas. 46 types, various conditions. Ayaskriti, Lodhrasava and Devadarva, the Arista is the very common Asavas and Aristas used in the diabetes. Though we have so many other combinations, this is very common. First line of treatment. The Ayaskriti, you see the combinations. Ayaskriti is having Asanadi Gana Kashaya. Asanadi Gana Kashaya. Asanati Nisha Burja Shveda Vaha Pragirya. You see, what is the Balashruti of the Asanadi Gana? Shitra Kushta Kapha Krimin, Pandurogam, Prameham Cha, Medu Dosha Nibarkana. And Vatsagadi Gana is a Churna, is Asavairishta preparation, Churna, Vatsagadi Gana, Vatsaga Murva Bhangi, Katuga Khud. That is the yoga. What is the Balashruti of the Vatsagadi? Chalakapha Meda Pinasa Gunma, Jora Shula Durnamna. Again, it is a Kafahara yoga. Ayaskriti also Kafahara, Medohara. Vatsagadikana also Kafahara and Medohara. So those two ganas mixed, and the Acharya recommends to add Loha with that one. Loha Bas. That is superior in the first line of Asavairishta treatment in the diabetes. Very effective. It is. You can add Lodhrasava with that one, or Nimbavradasava also with that one. And another important thing is that Ayaskriti and Lodhrasava is more effective in this Sthula Pramehi. According to Ayurveda, Sthula Pramehi and Krisha Pramehi, two categories are there. उसमें स्थूल प्रमेही को effective ज्यादा है Ayaskriti and Lodhrasava. देवदार्व्य अरिष्टा कृतप कृषभ प्रमेही को अच्छा है. ये कैटेगरी आप तो ध्यान रखना. Ayaskriti and Lodhrasava स्थूल प्रमेही के. So you can add Nimbavradasava or Kaishora Gulgulu, Chitragasava, Shilajit Bhasma or Karmada Bhasma, Abhra Bhasma, Valiya Marma Gudiga, Surya Prabha, or etc. along with the Ayaskriti. As I told you earlier, diabetes cases, you get so many types of skin lesions. There is no cure in modern medicine, but we have a cure. You add Ayaskriti with Nimbamrtasavam and give. The blood sugar also will gradually reduce, and the skin lesions also gradually found to be reduced. And the diabetes also joints pain. Mild arthritic conditions. Again, you can add Ayaskriti, Nimbamrtasavam with Ruko tablet or Chandra Prabha, Surya Prabha, all these things you can add. Obesity, Krisha Pramehi, Ayaskriti with Kaishora Gulgulu is found to be very effective. Reduces the blood sugar and reduces the body weight. And those who are having hypothyroidism, what is the line of treatment? Kapha treatment only. In hypothyroidism also, you can add Ayaskriti with Kanchanara Gulgul. Hypothyroidism. And PCOD children, girls, Ayaskriti with Kanchanara Gulgulu or Kaishora Gulgulu or whatever combinations you want to add, you can add. And diabetes condition also, again, people get pedal swelling, both legs swelling, ankle swelling. What is the remedy? You cannot give too much Mutrala Dravya. In diabetes, it is told that amedo mutralai. Amedo mutralai krishna. So what we will do? You can add Chitrakasavam with the Ayaskriti. It reduces the shobha, pedal shobha. And early stages of creatinine and urea also. This Ayaskriti, Lothrasava, Chitrakasava combination is found to be very effective. And diabetic related neurological bladder disorder. पेशाब में कंट्रोल नहीं है, बार बार जाना पड़ता है, ब्लैडर कंट्रोल नहीं है, क्या करो? अयस्कृति and Valiya Marma Gudiga. This Valiya Marma Gudiga, I think most of you people may not be aware of that one. That is one of the best medicine effective in the Mutragada Vahasrodas. So I used to give this Ayaskriti, Valiya Marma Gudiga, Shilajit and all these things in diabetic related bladder disorders. Neurogenic bladder. Neurogenic bladder is a very common thing. Chronic diabetes. Very poor control of the blood. In this condition, Valiya Marma Gudiga, one tablet with the Ayaskriti, Lothrasava combination or Shilajit, it is very effective. And the second one is the Lothrasava. I think you people are very well aware of this Lothrasava. Again, this is effective in the Sthula Pramehi. And Lothrash, Murva, Shati is the combination yoga. Bhalashruti says Megha, Arsha, Shutra, Krimi, Kushta, Panduroga, Grahani Roga, and Sthaulya. I always mix Lothrasava and Ayaskriti to get a full benefit of that. In the diabetic also, microalbuminuria is a very common problem. I think you might have seen the medical reports, urine report, all these things. Microalbuminuria. Lothasavam with Shilajit or Valiya Marma Gudiga or Shweda Gunjadi Gudiga. It is very effective. And change in the creatinine, as I already told, and pus in the urine, even for normal people also. If your Chandanasavam, Vishirasavam, all these things are failure, switch over to the Lothasavam plus Chandraprabha or Shilajit. Routine pus in the urine. Or patients who already hospitalized and was under the catheter, urine catheter for more than 1 or 2 weeks, it is very difficult to completely eradicate the urinary tract infection. Always there will be pus in the urine. Such cases, Lothrasvam with Chandraprabha is very effective. So as I told you, Lothrasvam and Ayaskriti is a common combination. And Valiya Marma Guliga and Shweta Guliga, you can mix along with that one. And Vasaarishtam is the next one. And that is a Brahmana Aushadha. That is why it is told in the diabetic neuropathy, Grahani, Arshas, Mutragarcha, and diabetic related Dadru, various types of skin disorders. I always give it in the diabetic neuropathy. Diabetic neuropathy, you can add all the previous medicines like Shilajitu, Valiya Marma Guliga, and all these things. And it is also effective in the weak bladder muscles, urine retention, and all these things. So only thing you have to remember that is effective in the Krusha Pramehi. The previous two ones effective in the Sthula Pramehi. And Vaidyavani, it is a very common thing, but I think very few people are only aware of it. Vaidyavani Ganam is main ingredient. Brahmana Vada Pittahara, the very best effective medicine for the Meniere's disease, vertigo. Vertin is the only medicine in the modern medicine. What is the Ayurvedic solution for that one? Vaidyavani or Vaidyavani Gana preparations. Every day you give. It is very effective. Vaidyavani Gadam. And our previous managing trustee PK warriors are used to recommend Dhanvandaram Shatapagi with Swarna Muktadi at bedtime also. If those who want to not, Dhanvandara Shatapagi capsules 2, Swarna Muktadi capsule tablet 1 at bedtime only. You can add Mridhusanjeevani, Srigandasava, Asugandharishta, Gurucharadi, etc. along with the Vaidyavani. Nimbamradasam means, I want to say, Gugulu, Nimbamradadi Panchatikta Gugulu is the famous yoga. Ayurveda Kotakala is manufacturing Nimbamradadi Panchatikta Gugulu, the Gugulu Tikta Kashaya form, Gugulu Tikta tablet form, Gugulu Tikta Grida form, Nimbamradadi-aasavas is also available, and Nimbamradadi Erenda. All are having the same contents in the various kalpanas. It is one of the best medicine. In my common practice, common public, poor people, working class, those who are having the arthritic joints pain, various types of unexplainable joints pain, they want to work every day, otherwise they will not have their bread and butter. Nimbamradasavam, Balarishtam, Punarnavasavam, Suryaprabha is my common formula. I repeat, Nimbamradasavam, Balarishtam, Punarnavasavam, all equal quantity, 30 ml, Suryaprabha tablet 2. So, a good improvement in the joints pain and inflammation. Working class, they can very well go to the work next day morning. A result assured. In the various types of skin disorder, as I told you earlier, Nimbamradasavam, Kutajaristam, Nimbamradasavam, Punarnavasavam, Nimbamradasavam plus Chitragasavam, Nimbamradasavam, Chitragasavam, Kutajaristam, all are very, very effective. Only thing, in the fever condition, you can add Vitumaran or Agni-Gubarasa or Amrita-Arishta also. Found very effective Asavarishtam. Please do not ignore this combination. In Madhuasava, you must start using. In some cases, you may not be able to write the Gugulu Tikta because that requires lot of diet restriction. Gugulu Tikta, Grida, all people may be hesitating to take the Grida and all these things. Start using the Nimbamradasam. You will get the same result. Saraswathaarishtam. Saraswathaarishtam, of course, you people are very well aware. It is containing Swara Brahmi as a main ingredient, and there is gold in that one. Stavari, Vidari, Kanda, Abhaya, Ushira, Sadahua, and so many other drugs, etc. Churna Dravyas. It improves the brain and brain functions. Blood-brain barrier in the brain. That barrier crossed, Saraswathaarishtam crosses, the research says. So it's very good in Alzheimer group of diseases. Alzheimer group of diseases. Dementia. Please start using. Don't wait for all other combinations. Start using the Saraswathaarishtam first itself in dementia and Alzheimer. We cannot wait. This is very progressing disease. You can start with Varavshaladi or some other combination, but always keep it in mind that Saraswathaarishtam also should be used. Then only it will be giving you some benefit. And we have Kotakali is having a Genicot. Syrup is there. In autism group and ADHD group of disease, I used to give 5 ml of Genicot added with 10 ml of Saraswathaarishtam and equal quantity of water. We are found to be very effective. ADH and autism group of, I won't say it is a cure, but children's conditions are much better. Varavshaladi Kashayam, Brahmidrakshadi Kashayam, all these things are also added along with the Saraswathaarishtam. Another thing I want to say that it is in the Falastudi, it is told it corrects the Rajo dosha and Shukla dosha. Anybody tried that one in the Rajo dosha and Shukla dosha? Male infertility, this is very effective. Male infertility, Rajo dosha and Shukla dosha. Though we have to use it for a longer period, male infertility to improve the count and motility. So Saraswathaarishtam found to be very effective. Instead of giving the tablets and all these things with the Suvarna, why can't you switch over to the Saraswathaarishtam? And only 2-3 more yogas I will say. Aragvathaarishtam. Aragvathaarishtam, I think We are using as a skin Arishta. Only one thing you have to keep it in mind. Aragudadi Kashaya yoga is different from Araguda Arishta. Aragadva Arishta yoga. Araguda Indreva Padala Kakatikta, that is the Aragadadi Ganakasha. But in Araguda Arishta, we are using the Araguda Panchanga Kashaya and Churnasthana, Vidanga, Amalaga, Abhaya, Trubhat, etc. etc. So there is a difference between the ingredients of the Aragodadi Aristam and Aragodadi Kashaya. And it is very effective in various types of skin disorders. Always use the Chitrakasam and Aragoda Aristam in the Shvitra condition. See, Chitrakasam contains Gomutra in it. So people may not be able to consume it easily. Pinically muskil hoga. So Aragoda or Chitrakasam milao. Milake de do. Shitra condition mein, leukoderma. And Prameha related condition also, Arshas and other thing, you know. I want to say that Aragodaristam plus Punarnavasavam and Viluvadi Gudiga, you can give it in various types of skin lesions, urticaria, Shita Pitta, Udarda, all these conditions. Gives you an assured result. Aragodaristam plus Punarnavasavam and Viluvadi Gudiga. Nowadays we started using the Dushi Vishari Gudiga also. So very effective. And next I will talk about the last 2 slides only. I think time is up. Kumaryasam. There is a public feeling that Kumaryasam is an exclusive medicine for the female. Female को ये किधर बोला? Kumaryasam ऐसा नहीं है. Male patients को भी अच्छा है. इसका बालश्रुति में किधर भी नहीं लिखा खाली female patient के लिए. Just like our Sukumaram Yoga. Sukumaram Yogam, people say that it is for female periods correction. No, it can be used in male also. Like that, Kumaryasavam contains Kumari, Sorasa, Loha, and so many other churnas, Trifala, Trigadu, etc. And it improves the Bela, Varna, Agni, Deepana, and all these things. See, this is a Brahmana Aushada. And it is good for Parinama Shula. It is Vrishya and Shukla Doshahara. Please keep it in mind. It is Vrishya and Shukla Doshahara. It improves the count. It is Vrishya. Kumaryasavam with the Chandra Prabha is very effective in early erectile problems. Erectile dysfunction in the male, early ejaculations in the male is a common problem. Early ejaculation, Chandraprabha and Kumaryasavam, it is found to be very, very effective. You can add Vasanta Kusumagar Rasa to improve the Prusya property, and Shukla Doshahara and Udara, various types of liver disorders and diabetes. It told that all the 20 types of diabetes will be cured with the Kumaryasavam. Not at least 1 or 2 type of Prameha, it reduces the blood sugar level. Mutra Grachra and Mutra Ashmari. I not tried it in Mutra Grachra and Mutra Ashmari, frankly speaking. Always we mix the Kumaryasavam and Ashogarishtam to regularize the menstrual cycle. That is the common use in among us. You can add Shilajit, Chandraprabha, Abra capsules, and in type 2 diabetes with various other diabetic medicines you can use. Kumaryasavam very good in female also. And Chabikasavam is the last slide I will talk. There are so many other Asavas and Aristas. Because of the time, I am not talking much about all other Aristas. Chabikasavam. Very few people are only nowadays writing this Chabikasavam. That is containing Chabika, Chitraga, etc. as Kaphahara drugs. Most of them are Kaphahara drugs. And it contains Vishala, Dandi, all these things, Trufala, as a Virechana Aushadas. And the Phalashruti, it is told Gunma and Prameha, Pratishyaya, Kasa, Vata Shonita, Udara, etc. It's in the common cold and cough. Shavikasava with Chukum Pippalyasavam Gudiga, Mukka Mukkadaga the Gudiga, Vittumaran Gudiga, with Surya Prabha, or with Lakshmi Vilasarasa, or with Mrityunjaya Rasa. Shavikasava is found to be very effective in the day-to-day pradishyayam, upper respiratory tract infections. Very effective. Children as well as the adults also. And Vata Shonida. And Vata Shonida, you can give along with all other kashayams or arishtams or tablet. Chavikasava is found to be amahara property. Amahara. You see the ingredients, all are kabhara. Amahara. It's very effective. So Chavikasam is very useful. Please start using that one also. And you can use it in various types of diabetes also, and gurma, gastrointestinal tract diseases, and kasa also. Kasa along with the vasha you can give, or you can mix it with the dashamula aristam also. So these are the very common asavas and aristas I would like to discuss with you now. And whatever the doubts you are having, please ask me. There are 23 questions in the chat box. Dr. Jiten, whether I will read, you will read the questions, chat box questions.
Good evening, sir.
Good evening.
Can you hear me?
I am very sorry about the condition of the slide. It was transferred from some other computer to this slide.
Can you hear me, sir?
You can ask the questions. Participants can ask questions.
Hello.
Please ask.
Sir, I'm doing in PhD in Asavarishta Kalpana from Brihattari. So I'm curious about, have you occurred any adverse reactions while prescribing this Asavarishta Kalpana, or the conditions where this Asavarishta Kalpana should not be used in specific diseases other than amlapika, acidity, or other?
That is the condition only. The only thing nowadays we are getting varnamishula, gastrointestinal tract, ulcers and everything. You have to be very careful. Otherwise, in general, there is no so much side effect in that one.
Okay, sir. And
Okay.
also one more question, sir, please. I would like to discuss with in detail. I would like to communicate with, if I can get your mail address or WhatsApp number, please, sir.
Oh, yes, I will get. I'll give.
You can contact Mumbai branch, madam. We'll provide the details in the group.
Okay, sir. Okay, sir. Thank you, sir.
There is one question. Diabetes, what are the Asavaritas are safe? That's a very good question. In my practice, if the blood sugar is above 200, fasting blood sugar and after food PPABS above 200, I won't recommend Asavaristas. If it is within the normal level with the medicine, then only I recommend Asavaristas. Otherwise, it is a little bit doubtful. Sometimes it increases. Okay. Ulcerative colitis, Asavaristas effective or not? I told you the Asavaristas which contain Shundi and Chitraga, you must be very careful. Very careful. Otherwise, you can use amoebiasis and IBS and everything you can use. Okay. Mukesh Kumar Jadhav. Next, madam, please. Next.
Sir, can you please elaborate all the avasthas, like Sama avastha it should be given or not, and what like Shakhagata dosh should be there, Koshthagat dosh, like in the beginning some avastha should be told, I think.
See, in Asavarishta general use, we can see that most of the Asavaristas increases the Kaya Agni, Dhatu Agni. So it increases the Agni, so it is effective in the Koshtha. If the Agni is improved, Madhuasavam, Chavikasam, it is indicated in the Vadashonida. So Shakhagata doshas and Astimarmagata doshas are also indicated. So in the beginning, if it improves the Agni, you can very well use in the all type of Dhatugata, Marmagata, Shakhagata, all these conditions. Okay.
Sir, I have heard somewhere that these should not be used much in Samavastha. So, what is your opinion?
That is very correct. In the early stage, we won't use any medicine. We give only Pachana Dipana Dravyas. But once this Pachana Dipana condition is over, see, you can attend the Pachana Dipana by giving simple Ashtachoga, Gangoshtaga, Panchakola Churna, Astachurna, and all these things within 1 week you can achieve. And strict diet restriction. What is the next procedure? एंड दूसरा बात है कि आजकल तो लोग ऐसा है जल्दी जल्दी बीमारी ठीक होने के लिए क्या दो we have to urgently start all the medicine. Patient will not wait for you. Combine the Pachana Dipana Dravya with the Roga Hara drug, then only you will get the result. 3 दिन बच्चे बाद में देखते हैं, 1 हफ्ते के बाद में देख कौन आएगा? We have to be practice pressure. जल्दी दे दो, जल्दी बीमारी ठीक करने दो. Okay. So see the condition and treat. Okay. Tell me, what is the next question? Anybody else is having? Can you please guide us for any book which contains only ingredients and indications, but ingredient descriptions, dhatu, dosha, effect? I think Chaukamba has prepared the English version of the Sahasra Yoga. Dr. Himasagara Chandramurthy, I think, has written some book about that one. Sahasra Yoga. Somebody has written and Chaukamba has published already regarding the Asava Yogas and ingredients in action. I think you can check it with that one. When to use Asava, when Arista, please explain. Asava is not, there is no Agni Samsarga. Please keep it in mind. Kalpana, Asavas, there is no Agni. We add the Dhataki, Jaggery or Sita or honey, Madhu and powder in that one and keep it for 15 days or 25 days, 30 days. The power is come in the Asava. Arishta Kvadha is the Kashayam we are first preparing, then adding the Jaggery, good or Sita or honey and Churna. It is more powerful is the Arishta. Okay. You understood? So according to the condition, we have to use together and can be the Kashayam and Aristam together. That is a very good question. Who asked that question? So I used to do that one, especially in the pediatric management, where we are not able to give Kashayam directly to the pediatric children. बच्चों को काढ़ा सीधा देना ओले लोग लेने का मुश्किल होगा. So 1 bottle of the काढ़ा, mix it with 300 ml of the Asava or Arista दे दो, according to the age 10-15 ml पानी मिला के दे दो, थोड़ा शहद मिलाओ, बच्चों के लिए बहुत अच्छा है. Sir, what is the minimum age limit using the Balamrit? You can start with any age. Any age. Can you give 2 or 3 months maybe? Start with the 6 months maybe. Congestive cardiac failure. Which Asava Arista? Congestive cardiac failure. Parthaderistam and Abhayaristam may be useful. With the Hridayarnavarsa a little bit. Okay. Kashaya tablet is similar effect as Asava Arista. अरे कषाय योगा डिफरेंट, कासवारिष्टा योगा डिफरेंट है. खाली गुग्गुलु तिक्त निंबामृतादि गुग्गुलु तिक्त एक ही कॉम्बिनेशन आता है. वंडरफुल सेशन. विश्वामृतम बालामृतम विश्वामृतम कॉम्बिनेशन सर. डोसेज बालामृतम विश्वामृतम डोसेज अकॉर्डिंग टू द एज ईच 5 ml 5 मिली मिलाओ, पानी मिलाओ दे दो और 15 ml को 7.75 ml ले लो और 10 ml दे दो. In GERD dysphagia combination can be used. Wonderful session. Good evening. Dosage of Balamurdam Vishwam dosage already I told. 5 to 8 ml. Please, Astajurna like medicine before Arista that is already having Agni Deepana property. Before food दे सकते. Asavarishta usually after food देने का है indication है. Okay. आसवा और अरिष्टा लिवर डिसऑर्डर. देखो लिवर डिसऑर्डर में आसवा अरिष्टा दे सकते हैं. बीयर में कितना % अल्कोहल है? 15 to 20% है. Above that all the rum, all other दारू आता है. हमारा आसवा अरिष्टा 5 to 10 ml 15 ml आता है. इसमें शुरू केस में, क्रॉनिक केस में नहीं दे सकते. शुरू केस में थोड़ा इफेक्ट है, लिवर का है तो असर पड़े है तो जरूर दे सकते हैं। श्रीगंधासव है हमारे पास, हमारे श्रीगंधासव दे दो, मदात्य में देने के लिए इंडिकेशन है, बहुत अच्छे रिजल्ट है, विड्रॉल के लिए भी बहुत अच्छे है हमारे श्रीगंधासव। क्रॉनिक केस में नहीं दे सकते, वो तो पक्का मालूम है। थायराइड, व्हाट इज गुड फॉर थायराइड? Thyroid already I told you, Ayaskriti, Kaiswaru Gugulu, Kanchanar Gugulu, very effective. Krishna Pramehi, in Krisha Pramehi, I told you Devadarishta is very good. Krisha Pramehi, Asavan Madatiya, Srigandhasavam, and Madhuasavam is also effective. Madhuasavam good even. Arjuna-aristam increases the BP. I don't think so. I have not seen any case like that. Arjuna-aristam used to give with HT coat or Sarpagandha Gudi. Shushka kas mein Vasaarishtam acha hai. Asavas can be given in very few cases before food also, no problem. Please send the recordings. Dosage for Pitta Prakriti person. Pitta Prakriti वालों को dose कम करने का 15 to 20 ml equal quantity पानी मिला वो दे दो.
Hello, sir. What is the difference in Vasaarishtam and Vasaarishtam?
दोनों एक ही है.
Okay, thank you, sir.
Asavas can be used like Lakshmana-aristam because it is not available in.
Namaste, sir.
Namaste. Lakshmana-aristam we don't have.
Actually, what is the medicine you can you please repeat for repeated urination in diabetes?
Lothrasavam with Shilajit or Valiya Marma Gudiga or Shweta Gunjadi Gudiga. Valiya Marma Gudiga and Shweta Gunjadi is vertical products.
Okay, sir. Shweta Gunjadi
Or Valiya Marma Gudiga.
Okay, sir. Thank you, sir.
Okay.
Namaste, sir.
Namaste. Bolo.
Sir, what can be given for post-viral myalgia, sir? Treatment. Post-viral fever myalgia.
Post-viral fever myalgia, I told you, we can start with the Madhuasavam, Balareishtam, Punarnavasavam, Surya Prabha combination. Madhuasavam, Balareishtam, Punarnavasavam, equal quantity, Surya Prabha. Madhuasavam, Balareishtam, Punarnavasavam, Surya Prabha.
Hello, sir. Hello.
Hello.
Good evening, sir.
Good evening. बोलो, सुनते नहीं.
हेलो सर.
बोलो. I'm not able to hear you. Tell me.
ये रिकॉर्डिंग बाद में मिल जाएगी ना, इसकी जो सेशन हुआ है.
क्या बात है?
Is recording available after the session?
Yeah, please contact our Mumbai branch Matunga, Dr. Jitin.
Yeah, thank you, sir.
Sir, namaste. Hello.
बोलो.
Sir, good evening.
Good evening.
Sir, my father is suffering from atypical Parkinson's. I mean, it's as per Ayurveda, it's Majjagat Vat, and as per modern, it's brain degeneration.
Okay.
He's having constipation and continuous weight loss, sir.
Okay.
I have given many laxatives, and those are not so effective. And he's having continuous weight loss. So,
Okay.
is there any treatment like you told Balarishtam for Dhatu Poshan? And for brain regeneration, is there anything so that
Saraswathaarishtam plus Balarishtam you can give.
Saraswathaarishtam
and Balarishtam mix you can give.
Okay. Dose, sir?
Dose 15 ml each.
Both mix करके
both mix 15 मिली मिलाओ दे दो.
Okay. जी,
सर
थैंक यू सर.
पार्किंसनिज्म के साथ अगर डायबिटीज भी हो तो यही कॉम्बिनेशन चलेगा?
डायबिटीज है तो अयस्कृति, सरस्वतारिष्टम, लोथरासवम, सरस्वतारिष्टम वो अच्छा होगा.
नहीं, उनके साथ पार्किंसनिज्म भी है.
हाँ वो यही अच्छा होगा. डायबिटीज का भी मेडिसिन देना पड़ेगा साथ साथ. सरस्वतारिष्टम प्लस अयस्कृति, देवदारव्यारिष्टम वो सब मिला के दे सकते.
Okay, sir.
Anything on for patients on dialysis? I don't take any such cases. Anything, patient? No, I don't think. Okay.
Good evening, sir.
Good
I have a
evening.
question. Good evening, sir. I have a question. Sir, can we use Koshayam with Ashava or Aristo?
Oh, I told you already. I told you, especially in children, I used to mix Kashayam with Asava and Arista. My combination is 200 ml of the Kashayam with 300 ml of the Asava and Arista, and according to the age, dose division. There is no harm. I found to be very effective.
In case of pediatrics only, sir.
Not only pediatrics, up to the age of 15, I used to give.
Okay. In case of geriatric, in case of geriatric condition, can we use this combination?
See, Acharya told all these things according to your practical yukti, buddhi. Mix anything. Only thing, you must have a base. This is the reason you are mixing. This is not the reason you are not mixing. आपका युक्ति के अनुसार जो भी कॉम्बिनेशन हो वो मिला सकते, वो दोष दूष्य धातु अवस्था आमावस्था वो सब देख करके आपको कुछ भी कर सकते, आपको फ्रीडम है.
सर गुड
गुड इवनिंग
सर. गुड इवनिंग सर. which one is effective? Opium.
क्या लग which one?
Opium addiction.
Opium addiction बहुत मुश्किल है.
In opium addiction.
Very difficult, very difficult, sir.
Okay.
मेरे पास दवा, we don't have any such medicine.
Sir, good evening, sir.
Good evening.
Sir, up to 1 year, any Asvarishta can be given?
We have Aravindasavam.
Only Asavas.
Aravindasavam, I didn't mention about that one. There are a few more Aristas left. Aravindasavam is the best medicine for bachon ka. Or drops, 5 to 10 drops with the water, you can give. There is no problem.
Yeah.
Hello, sir.
Only you.
For maximum, how much duration?
Sir?
For maximum, how much duration we can use Asavas?
Continuously. इतना पीरियड नहीं है, नहीं बोला. In according to the condition,
मैक्सिमम कितने दिन तक दे सकते हैं सर आसवारिस्ट?
किसको?
एक लिमिट है क्या सर उसकी?
कुछ लिमिट वो नहीं बताया. एक बार बीमारी ठीक हो गया आप स्टॉप कर सकते हैं.
ओके सर. ओके.
Hello, sir. 6 months to 1 year, which Asvarishta can be given? Arvindasava, except Arvindasava.
Arvindasava, Vasaarishtam, you can give. Balamurti, you can give.
And rheumatoid arthritis, which is the best medicine, sir, and Vatrakta?
Vatrakta, we have to see the condition, sir. What are you
Shota, Kapaja Vatrakta, Gambira is there.
Gambira means you start with the Amrita, beginning Amapajana, Deepana, start with Amrutara, Punarnavasavam, Chandraprabha, and then switch over to the Nimbamradi Panchatikta, Gugulu, Kada first, then the Ghee next. Like that.
सर जामनगर में एक ADR रिपोर्ट हुआ था कि कंटिन्यू 1 साल तक जब 10 मोलर रिस्ट दिया गया तो उससे कुछ लिवर सिरोटिक चेंजेस आए थे. तो सर ऐसा कुछ हो सकता है क्या सर अगर लंबे समय तक देते हैं?
मैंने सुना नहीं है अभी तक. देखो
जामनगर में सर हुआ था सेमिनार, उसमें ADR रिपोर्ट हुआ था सर ऐसा.
अच्छा मैं आई डोंट नो. हमारा पब्लिक जो लोग जो है ना केरल में, वो लोग ओवर द काउंटर दशमूल जीरेगा आकर के परचेज करके जाते पीते हैं. उन लोगों को अभी तक कुछ बीमारी वो लोग बताया नहीं है.
जी सर.
अभी तक बीमारी हमने देखा नहीं है.
ओके सर.
ओके. जो भी दवाई है उसका आवश्यकता कितना दिन तक है वो डिसाइड करो, देन यू यूज इट, स्टॉप इट. और इसलिए शास्त्र में बताया दवाई ज्यादा टाइम यूज करने से वो एक टाइप फूड खाना की तरफ आ जाएगा, दवाई की तरफ काम नहीं करेगा. ओके.
साथ में हो जाएगा.
साथ में हो जाएगा. ओके.
ओके सर.
Hello. Sir, from which avastha is proper to use Asavarishta?
Asavarishta. In the Amavastha also you can give Diprabhajana a little bit. Only thing you have to see the condition of Pitta in the Koshta. Pitta is too much aggravated, we cannot give. If the Kapha and Vada is dominating, you can very well start. Okay. And
So, for example, right, for if it is jvara. So, sir,
jvara, we will not start with the Asava-Arishta. First, you start with the Shadanga or Dipana Pachana Kada or Paniya. Then see the condition. Then if there is a Kapha Avastha is there, Ama Avastha still there, then you select some tablets. Then you switch over to the Kada. Then again, if the condition is improved, then you switch over to the Asava Arishta. Then last Kshira Paka. Then last goes the Grida. That is a very systematically it is told in the Kashaya.
Good evening, sir.
बोलो क्या बात है? Colitis के लिए I told it is Duralabharistam, Mustam, all these things are very effective. And Madhuasavam again very effective. Colitis and all these things. Colitis requires not only Aristas or so many other medicines also is required. Increased uric acid and serum. Combo of Arista. Why combo of Arista? You can potentiate it. You can potentiate the action of the Asavas and Aristas. That is why combo. दोनों को रिजल्ट मिल जाएगा. Endometriosis system में you have to give so many other medicine. Madhuasavam, Abhayaristam, Stragasavam, you can give dilution of Asavaristam compulsory. बच्चों के लिए compulsory. Dilution is compulsory, not for adults. Okay. Okay.
Sir, which one Arist is effective in the Anartha?
Kumariasavam.
Kumariasavam.
Yeah.
Okay, sir.
हेलो गुड इवनिंग सर.
गुड इवनिंग.
हाँ सर, पालित्य में कौन सा आसव अरिष्ट यूज करना चाहिए?
कौन सा?
खालित्य और पालित्य में.
खालित्य पालित्य में क्या दे सकते हैं साहब? मृद्विगारिष्टम दे सकते हैं. मृद्विगारिष्टम अच्छा है बालों के लिए. मृद्विगारिष्टम. Parasitic fibroids. The Madhuasavam, Abhayaristam, Stragasavam and all these. Okay. I think it is time up. Generally, we discussed most of the points, I think.
So I think we can wind up the session.
We can wind up the session, Dr. Jitin. So I am very thankful to the Dr. Jitin and other people, officials in the Bombay branch for giving me the opportunity. And the listeners, doctors also, good questions they asked. Very much thankful to you. I'm really sorry about the condition of the slides. I will see that next time I will present in a better way. Okay, thank you very much. Thank you.
Thank you, sir. Thank you very much, sir.
Dr. Jitin.
Thank you, all the doctors.
Dr.
Thank you,
Falja
sir.
is
Thank you
still
very much.
sleeping. Dr. Falja is still sleeping. Okay, shall we close?
Yes, sir. Yes, sir. Please, sir. Thank you. Thank you very much, sir.